Welcome to Loveology University's course on Transgender, Female to Male, an overview of the trans man's experience. This course was written by Dr. Zhikhareva, also known as Dr. Z, and she's a clinical psychologist specializing in transgender care who has worked with transgender individuals for over 10 years. Dr. Z founded the Hormone Readiness Group for Trans Youth living in Portland, Oregon, and she is now the facilitator of the Transition and Beyond group in Los Angeles, California. Many trans men seek hormone therapy to help their bodies masculinize. Physically, hormones reduce the secondary sex characteristics of the original sex and enhance development of secondary sex characteristics of the desired sex. Now, secondary sex characteristics are the features of the body that define its gender other than reproductive organs. For example, in women, things like breasts, more scalp hair, and less body hair are considered secondary sex characteristics, whereas men have more facial hair, an Adam's apple, more muscle mass, and broader shoulders. Primary sex characteristics, on the other hand, are things like the penis, testicles, scrotum, or prostate in men, and uterus, vulva, vagina, clitoris in women. Psychologically, hormone treatment can result in feelings of fulfillment and well-being. Some trans men may not feel comfortable with their genitals, and therefore they may want to explore different kinds of touch. And since erogenous zones exist all over the body, there are many ways to be sensual and many places to explore and touch. You can get your partner to rate their erogenous zones and body parts on a scale of 1 to 10, with 10 being the most pleasurable, so that you can identify all the different places that they enjoy the most, from their scalp, their earlobes, their armpits, their inner thighs, their feet, their neck, or their genitals.